almost 5:45 and still people in the room. I'm really impressed. So you really must be interested in the topic. And of course, health equity is a big thing, and as much as safety is a big thing, as we heard before, and devices and software can help a lot in doing it, but of course we all know technology can be used either way. So that's basically what we are going to talk in actually the last round of this conference. And yeah, a lot is going on, definitely, Art. And you with a big consultancy firm, some of you may have heard of Accenture. So I think you can give us a little, quite a good market overview where we actually are and what's going on.
Thank you, Dieter. Hi, everyone. I'm Dr. Arti Thapliyal. I lead the industry innovation practice for health and public services business for Accenture. And as a part of that, we support our clients across different markets like North America, Europe, UK, APAC. And I think, Dieter, in simpler terms, I would like to explain health equity across 3 different tenets or principles. When we talk about addressing health equity and how can technology play a pivotal role in addressing health equity is basically around equitable access, healthcare, equitable healthcare outcomes, and experience. So when I talk about access or equitable access for that matter, we talk about how solutions, technology solutions can be made relevant for all kind of populations. For example, when we talk about digital solution designs or we talk about multilingual support to different kind of populations, I think the health minister of Malta put a huge emphasis on how e-labeling of medication could be actually made available in different languages across different EU countries so that people are able to understand prescription and then make an informed choice and follow the drug regimen. Same goes for voice-enabled services. So we have different kind of population that is not digital savvy. So lots happening within technology for voice services, especially for geriatric population or the baby boomer population across the globe, or people with any kind of disability and other challenges. Then we further have digital solutions which are designed actually for different disability groups across the globe, be it the visual disability or any other kind of disability that you have. And telehealth platforms, of course, that's a no-brainer. All of us would have seen many telehealth platforms booming in the market today, right? Especially during COVID time. We have global partnerships that we saw where products were rolled out by Microsoft, by Salesforce and whatnot, which transformed the way healthcare was delivered in order to enable access for everyone, and remote patient monitoring again is a classic example where we saw device innovation, and I think a lot of startups have been talking about that. And then comes the second thing I spoke about is the care outcome. One is access, equitable access, and then equitable care outcomes. How do you make sure that we get the right outcomes out of the care that we provide for all kind of populations, right? So not just one kind of population. So we looked at some studies in North America wherein we learned that a lot of the solutions that exist today are very white population centered. So essentially not designed in keeping in mind the ethnic requirements of other population groups or and so on, right? So how can we bring in that inclusivity in our solutions so that the care outcomes are also accordingly, right? Because there are genetic requirements, there are hereditary requirements, there are environmental requirements and whatnot that play a crucial role in healthcare outcomes. And very importantly, as per studies, 80% of the factors that influence your healthcare outcomes or the clinical care outcomes that you see are non-clinical. So it's everything else that happens that plays a significant role which we tend to miss. And last is the experience part. Of course, we need to design solutions which are very inclusive when it comes to experience for different kind of populations. And that's where we also talk about social determinants of health. Again, this term is has become pretty popular in the past 1 decade, but it's very, very important to kind of keep in mind the social determinants of health for different populations so that the services that we design, be it the technology services or the softwares or the products in the healthcare market, are very inclusive and make sense to all kind of population groups. I think that's what I feel, Dieter.
Well, so this was really giving a big picture, and the need definitely is there. Let's go a little bit now on the micro side of it, Alexander. Yes. You also a consulting, but with a smaller company. So you are in very intense startup contact, let me put it this way. So what is the situation there?
Yeah, thank you, Dieter, for asking. My name is Alexander, Alex from Digital Oxygen. I'm helping to bring in healthcare manufacturers with digital products to the German market and pave them the way into the sometimes healthcare system reimbursement-wise and sometimes also out-of-pocket or B2B-wise. And what we see here is in Germany that there have been a lot of policy-making initiatives over the past year enabling even companies to start operating, such as companies that go into prescription paths for applications, maybe now also going into prescription paths for care applications. And what we here especially see is that the manufacturers sometimes struggle with the regulation that is being put on them, and sometimes also need to make a trade-off. Is this market that we're currently looking at, is it from a relative point of view, is it still attractive enough if we consider all of the regulatory frameworks that we need to fulfill? And this is, especially when we work with international companies and international startups, a very decisive factor. And these frameworks that have been put out in the German market have drawn a lot of attention from across the globe. We've even have companies from South Korea looking into the German healthcare system, which is quite astonishing, as I believe. But maybe one thing to add what you just said, when we think about inclusiveness of healthcare applications or healthcare products, we often tend to think of the one blended patient persona that is out there in the market and then try to build an application that fulfills all of their needs. I think in the future we will need also to consider that there are certain patient groups which do not have the same needs as all of the other ones, and there might be, for example, different needs for healthcare applications for kids than what we would see for elderly. And maybe also when we think of socioeconomic other factors, for example, also language-wise, not everyone might have the same needs if they are not native speakers in the specific country that we think of.
Well, yes, and but there is one big issue we haven't touched yet, and this is the matter of regulation, because everybody sees the potential, but also the dangers, and that's why a lot of regulation is. And I think, Jeyla, you coming from Switzerland with your product, a very well organized country, we know, but I think not an easy one when you are in the startup field and you try to push innovation.
Absolutely. So our startup, Testasy, that was innovating in the field of digital diagnostics. We were based in Zurich and we're operating in times of COVID. So you would imagine things happen fast, people recognize the urgency, and we try to create safe solutions. So our solution was fully digital, very safe. It prevents you from going to an overcrowded test center and exposing yourself to risk of infection. However, despite Switzerland being very well organized and being hailed as the Mecca of medicine, according to some, we came across not simply lack of regulation, but also resistance from authorities to recognize that there is a need to audit, to inspect certain technologies, certain solutions, and especially in times of COVID, help them be on the market legally. So a lot of technologies don't have the opportunity to exist legally, specifically because despite of the amazing technological advancements of amazing coverage in Switzerland, they don't have legal basis. So there's no digital health per se in Switzerland in legal terms. There is e-health, but it's not being enforced in any way. So another layer of complexity is being added by the fact that there's different cantons, 26 different cantons, and something that might be legal in Zurich is not legal in Geneva. So especially for smaller startups that are trying to solve big problems, that creates a lot of frustration, but also it costs a lot of money. And according to McKinsey's 2022 study, Switzerland still has 8.2 billion francs to get from digitization of the healthcare. So they could save up billions if they digitize quicker, if they care about solutions, about legal frameworks around digital care. digital health. So unfortunately, it's still quite rudimentary. It still has a lot of resistance, and it's still quite slow in the country.
But I think it's also, well, this is Switzerland, a relatively independent entity in Europe, while the EU is a very complex thing, and we all know other regulation approaches, and well, your company is based in the UK. And so that making it even more complex, you're not in the EU anymore. So what does it mean? Because you also are very active internationally, of course.
Yes, we try to. So we have an entity in France. So we're technically, our company is also based in the European Union, but we started off from the UK. And in terms of regulation, we were part of the lucky few that were still able to have a medical device under MDD before the switch to MDR. So we're still a class 1 medical device for dementia prevention, risk detection of future dementia. And we're in the process of switching to class 2A under the new MDR regulations, but obviously it is true, I second what you're saying, that it costs a lot of money, money that as a startup is obviously very precious. It's also, in terms of resources, in terms of human resources, who knows those, I mean, people who know and are experts in MDD to MDR, notified bodies, those resources are very scarce, and there are more and more startups out there that are looking for a solution. So it is a very complex and challenging environment to be in, for sure. Whether you're in the UK and EU, doesn't really matter.
And Dieter, I'd just like to add, I recently came across this DTAC that our colleague before mentioned. So the Digital Technology Assessment. And basically, I had the privilege of speaking to the lady that was leading this effort in the UK, and she said the DTAC is absolutely nothing new, but all the regulations were so fragmented in the UK market, nobody knew where to look, so they decided to compile them into one and create this, you know, consistent guideline for startups who don't really have money, as you said, to pay to lawyers to like dig into that and spend their resources on that kind of research. They just look into DTAC, and it has all the basics such as GDPR, how to enter the market, how to be compliant. So this is something that can be applied to all of the markets, because those things are essentially there. You just need to compile them and make sure it's available, especially to younger companies.
We should also try to deforest some of the regulations, because there's absolutely way too much, and it's really killing innovation. I know we could finish this panel with talking all about that, but there are more issues to cover, and the time is, as always, running. So let's go to another aspect that's very important. People need to be aware of these new products. They need to accept them. They need to adopt them. That, I think, is a very important issue, but also not easy to accomplish. What is your approach on that? Jeyla, for instance.
Well, I can tell you from two markets, originally from Azerbaijan, and although I have never worked in healthcare in Azerbaijan, as a patient, I see that there's a lot of money being invested into technology or equipment. They bring that into the medical system, into clinics, etc. And same with Switzerland, you know, they have all those regulations that relate kind of to healthcare and digital. They say that we're the most innovative country in the world in that sense. However, the one thing is missing, and that's the fact that you need to think digital instead of just knowing that there is a technology out there. So it's not just about bringing in a bunch of equipment, it's also about thinking, how do we solve new problems with new thinking? Instead of going step by step, traditional way, and digitalizing it, we should think about what are the new technologies that can allow us to skip 3 steps and already get specific results in this context. So I think from my work and my professional experience, This is the digital awareness, the digital thinking is missing, especially in large corporations, especially amongst clinicians, especially amongst professors who think that, okay, digital is fine, but we can do this better the old way. So I think that's the key element, instructing people not just how to use technology, but also how to think technologically and in a new way.
Alexander, what is your approach on that? What do you advise your clients?
What do I advise my clients? What I request, or there's two things. One thing that I request from policymakers that implement and allow new ways of working and want to foster digitalization in the healthcare system to also speak about it and do campaigning about it, because there can be a lot of great things in our healthcare system, but if no one knows of those, they will never be used. I think what would, from a public opinion point of view, foster this development would be, or will be, when we will see the first digital health unicorn in the German market, for example, or in other European markets, so standout companies that everyone talks about. There are those companies, but they are yet too small to really catch attention outside the healthcare community. So I think this is one of the key moments that we will see in the next years, which will really lead to a jump start and a big bang for healthcare.
Clara?
Yes, actually I want to maybe bring on, because before founding 5Lives, the core team is from a mobile consumer gaming actually background, where we did a lot of digital advertising on the typical platform, call it Google Ads, Facebook Ads, etc. And I think these platforms, typical digital advertising, should definitely be put at use for promotion of digital health and emphasizing digital health literacy. We're in the field of dementia prevention, and by that we are facing a lot of stigma. There is a lot of stigma around Alzheimer's disease and other dementias, even still in the medical community, even more in the patient community. Some people do not recognize it still as a chronic disease. Other people think it's a normal part of aging. However, we are using our experience in digital advertising to promote the message that it is a chronic disease. There are ways to prevent it, and here is the scientific evidence that we've collected to show it to you. So I think definitely digital health solutions should not be shy of exploiting typical consumer digital advertising platforms to spread their message and emphasize digital health literacy and their message.
Well, Art, it's now on you also to say something about how you advise people to this, well, education, this adoption problem.
For that advice normally.
I absolutely bang on agree with what I think what Jeyla said and what Clara said and what Alexander said. I think rather than getting into the rat race of digital, it's very important in terms of the meaningful use of digital, right? So we have phygital ways of working, this term called phygital, you know, where do we exactly need a brick and mortar hospital versus where virtual care could work, versus not everything has to be done in metaverse, which is very fancy, but it needs a lot of infrastructure, right? There's a lot of foundational infrastructure that has to be put, legacy systems have to be get away for some of these cool technologies to work. Maybe metaverse is good for a behavioral health patient or for a pregnant woman or for someone who has a physical disability or elderly, but maybe not for other population, right? So those are the questions we need to ask, that what is the meaningful use of digital? What are those use cases in which we would want to use digital? And at the end of the day, I think technology, I would like to close with that technology will play a critical role in two aspects. Number one, capturing the data to inform us better in terms of where do we need what solution, and then solve for it, leveraging all the deep tech that you talk about, AR, VR, AI, metaverse and so on. So that's how we can look at it.
Well, I'm always saying technology can be used either way.
Yeah.
It is on us how we use it. And we have seen a lot of good examples and a lot of good approaches how we can tackle the problem. And to give a little advertising blog for the Diplomatic World Institute, that's actually what we are here for to do. We want to foster debate on all these issues and across borders and across sectors in order to help to make this place a better place. And I think we made quite a step forward into this direction. Thank you to all of you. And all of you, thank you for being here in the room so late, and have a nice evening and a nice weekend.